And joining me on the news from Kent, United Kingdom, is a public affairs analyst, Benga Onifade. Good to have you join us, Benga Onifade. Now, let's look at the recent statement coming from a parliamentarian who is in charge of the COVID-19 for the parliament, Nadim Zahawi. He said UK is getting safer every day as 1 in 5 people have now received the vaccine. Is that the general sense among residents and citizens of the United Kingdom?
General incentive from most people. The R rate, which is more or less the infection rates, it is coming down effectively as compared to April 2020 when it was at its peak. So yes, I would say so. That's correct, because more people now are looking at respecting the lockdown. I think the social distance is actually now more in focus, considering, if you think about it, we have effectively been on lockdown for more than a year, well, just about a year now. So yes, people do not have any other choice because they just want to get back to their normal lives and want things to resume.
So let's look at the recent regulation coming from the Prime Minister, as people will now be staying in hotel quarantines, will be placed in hotel quarantines if you're coming from about 30 listed countries, red list countries. This is coming at a time where about 4,000 variants of the virus have been found in the country. Let's get your thoughts on this.
This is actually very strange, because when we do have people arrive from other countries, for example, if you think about it, I think the UK found the first variants of this COVID. Now we've realized there's been about 4,000 different variants. And then I think just about days apart, there was another one that was found in South Africa. And one of the things is we've got these vaccines, they do not treat all the variants. So what we've got in the UK is UK specific. That's what it will treat. So it will complicate data if you get other people from different countries, coming with different variants. And if you think about it, for example, the UK, the Oxford vaccine would not treat certain variants, and Switzerland, for example, just said they're not going to accept it because data has not proved that it will work. So I think in order to make things safer and just to less complicate things, it's best to just make sure people are compulsory quarantined. That way, this whole symptom, eases out of the body naturally, instead of just forcefully trying to vaccinate them.
Some people are saying this is a little bit too late. For example, when UK first discovered a new variant in Britain, a lot of countries banned travel from the UK to their countries. So how come it took the UK this long to ban travelers or to place travelers on quarantine after 4,000 variants?
I think I would maintain the same opinion, actually. Many people think it's a little bit too little too late, because it was actually discovered in the UK the first time. And in fact, I was meant to travel, if I recall lately, a month ago, to Nigeria myself. And then the government, effectively placed everyone on lockdown. I recall calling the airline, and they said, well, the planes are still going on as regularly as normal. And, a few of my friends did travel, and I could recall, about 2 weeks later, they are asymptomatic, nothing at all happening to them, but they had to test themselves. And when they tested themselves, they found out they were very positive. They were reacting to, they test positive for COVID-19 despite not showing any symptoms. I think one of the mistakes we made was the fact that we trusted so much, and we put our health, everything into the vaccines, which shouldn't have been done, because UK's got one of the strictest borders, if you think about it, because by the time you come, you're forcefully imposed on quarantine for 14 days, and at the same time you will be told to show that you are positive, you are negative, before you're even allowed to come into the country. So I think that, in that way, they've actually got it wrong, not realizing, a bit late anyway, that, we've got different variants, and these vaccines do not treat all variants. So I probably will say it's the data that came in a bit later than normal, than imposing blame. But the fact that, we've got to actually look and concentrate on the fact that the R rate is coming down effectively, which just shows that we'll get safer. The death rate is coming down, because 110,000 deaths, which puts UK the highest in Europe and number 5 in the world. That is not good enough, and I'm sure the government do not like that.
All right, it does seem like Scotland has a stricter COVID-19 restrictions than the UK, and the Labour Party is now saying that the UK should ban should put off travellers coming from all countries on hotel quarantine, and not just from some 30 countries. Do you agree that that is the right thing to do?
think so. Even though the data that came in last December said, well, I think I only found that a bit later myself. So we've got 4,000 different types of variants of COVID worldwide. Scotland, which is one of the 4 countries in the UK, has been very efficient in the lockdown measures as compared to England and which happens to be the most, the most troublesome among them all, really, in terms of being more relaxed in terms of the COVID, and he actually has the most cases. So I will say, England should probably need to step things up a little bit more. I kind of forgot your question there, but England needs to step things up a little bit more. We probably need to look a lot more into what Scotland are doing, our neighbouring countries are doing, because if you think about New Zealand, for example, I mean, you probably could say the fact that they are very remote and the fact that people do not travel as much. They're fairly isolated. Things have come down, and New Zealand are willing to help, lend us some of these measures that they have taken in implementing into their approach. So yes, Scotland, one of the 4 countries in the UK, has actually done very well, but England could do well in copying those measures. I would agree with it, yes.
All right, we'll see how this new hotel quarantine regulation from the UK plays out in terms of numbers. Public affairs analyst Gbenga Onifade, thanks for talking to us as always.
Thank you.